division. This is the Dry and Rejuvenation Center. This is where we do our diagnostic examination to figure out how good or bad some of these tears are. And if we have to do a treatment, we have a room full of treatment that would include some of the latest, greatest radiofrequency devices designed around the prospect of heating glands to help unclog them. This is considered an off-label use of this equipment, but I've done studies that have already shown that this works better, or at least as good as any of the existing equipment out there. The side effect is it can leave people looking a little bit younger. We have an operating microscope that allows us to take kind of a running exam of what's going on, but to also do fancier treatments. And the beauty of that is that we can iron out some of the wrinkles that exist on the membranes of the surface of the eye to make that smooth again so the tears have less resistance in moving around. We have a device to help clean the lids called the BluffX, and ZocuWipes and ZocuShields are ways of doing a higher level of clean. We have some of the best eyelid products there.
It's amazing to see our product here.
To help some of these folks who have had substantial treatments to their face and skin to be able to help that process of healing. We have an intense pulse light machine, which is again sort of top of the line as far as being able to do a variety of wavelength treatments to skin and around the lids and even over the lids.
Can I ask you a question about this RF instrument? The temperature of the subcutaneous, I think, area is like 50 to 75 Celsius.
That's if you're trying to create an actual structural burn. So when you consider that there are different applications of radiofrequency, it's actually been used for over 100 years in medicine, starting with people who were doing like neurosurgical things with this kind of stuff back in the 1920s. And the beauty of that is that you can use it for cautery, you can use it for skin rejuvenation, you can use it to selectively target bad lashes to get rid of them, like electrolysis type of thing called hypercation. You can use it for ironing out those little wrinkles that I told you about, but also for cutting and doing other surgical things. If your goal is thermage, which is a beauty treatment that uses an externally applied radiofrequency device, thermage aims for that 65 degree centigrade temperature that's focused ultrasound-like energy. This is radiofrequency energy, but that focused radiofrequency comes to a point where it creates actual thermal damage, like an actual structural burn. And that's at some level beneath the skin that will encourage healing and tightening. And so when you do that, you generally have to give people kind of narcotic level anesthesia because you want them to be able to tolerate what is a pretty powerful burn. And you do that selectively around the face to try and create those little focused burns in places that will have that little healing and structural change.
So Dr. Jaccoma, what are the biggest questions that people have for you?
So I think most people are concerned about, number one, staying healthy, and number two, having their bodies look as they feel, meaning that you don't want to look older than you feel or necessarily show your age if you don't have to, if you would like to have that youthful appearance. So in my world, I get to treat both sides of that coin. So one is to keep the eyes healthy. It's important to keep a healthy surface, which is important to keep healthy tears. But it turns out some of the same treatments that we offer also are good at keeping skin looking healthy and keeping the eyes looking healthy even as they're working better. So when it comes to skincare, I often get asked, is there a perfect cream? Is there a perfect treatment? There are so many out there. How do you choose? What do you do? I think sometimes what you don't use is as important as what you do use. And one of the common things that you hear about are these so-called retinoids or the age-defying products, which are pretty good if applied to those parts of your face that are best benefited from that, but are particularly awful if you apply them around your lids because you have little oil glands that are trying to do their job. And the effect of these so-called retinoids is to shut down oil glands, which is why in a teenage person you might choose to use it to help with their acne. That is why sometimes by encouraging your skin to be more youthful with these retinoids that you can keep less fine lines and wrinkles. But when you apply that around your eyelids with the same hope, you're at the same time shutting down oil glands and then depriving your eye of some of the useful oils that are so necessary to a healthful tear. So I like to look at natural products, try and find ways for us to stay healthy naturally. I think that's kind of the way nature intended. And so not to say that there aren't particular chemicals and chemistry and medicine that can be useful, but also to try and look at how do we find a balance and how do we keep our skin in kind of the optimal health without taking unnecessary risks. So this is why I've found it particularly interesting to work with you. You did bring up a question earlier about sunblock, and I would like to touch on that because when I had the opportunity to work with a cosmetic dermatologist who happens to live and work in Miami, Florida, where you would have more sun than you might have here in the Northeast, her very sage advice was, in the first dollar that you spend on trying to make yourself look youthful, make that first dollar spent on sunblock, because that is a preventable cause of obvious aging. And so if you let the sun do its active work on you, it is going to basically tear your skin down in a way that creates more lines, wrinkles, skin cancer, age spots. And if you avoid all that, your skin will always look more youthful. So why not work on that first? So I think, being cautious about the sun is really important. I think being, in a way, fostering skin health, that you could start by recognizing that being out in the sun is a healthy thing, but letting the sun burn your skin is not a healthy thing. So you want to be out in the sun. You just want to find ways to protect yourself from the sun so you're not letting it have undue damage on the surface of your skin. We could approach in a stepwise way because there is no one single wand that I would wave to fix everybody the same way. I think it's important to recognize that genes and age and how we take care of ourselves will greatly influence how we age and to a degree what we want as our youthful bar. So in other words, some people might not be satisfied until they look 10 years old, and somebody else might be happy to look their age, just not older. So there is kind of a range in terms of what we're trying to accomplish, and you want to kind of take that into account. Listen to the patient, try and understand where they're coming from and what their ultimate goals are so that we can meet those goals as best as is possible. Starting with the most simple thing, again, getting back to sun protection, I think that is the most basic thing you can do. Try to not let the sun damage your skin in a way that you have to play catch up on. So that's pretty easy. Just use good sunblock and be somewhat sun protective. So wear a hat, cover up a little bit, but don't be afraid of the sun. Be out there. It's just the idea that you want to protect yourself. The second thing is it more of a complexion issue, or is it more of a substantive, more basic skin issue? So are we talking about wrinkles, or are we talking about complexion like brown spots and red spots and that sort of thing? If it's a altered complexion, making the complexion look more even can take years off just by helping somebody look more kind of even throughout their face. Can make a big difference. And then when it comes to dealing with that, things like the intense pulse laser-like light that can be used to shut down little red spots and to help iron away little brown spots and even do a little bit of fine touch-up on some of the lines and wrinkles, that's pretty useful for a lot of people in the sort of earlier stages of having issues. When you get to larger degrees of wrinkles, you have to look at it from the standpoint of, is this loss of air in the balloon? One of the things that happens to our face as we age is that we lose some of the fat, we lose some of the muscle, we lose some of the bone, and all of this allows a deflation where things start to sag and then you see more obvious wrinkles. In a case like that, if it hasn't gone too far and somebody can easily address that just by sort of one or two fingers, that's where the fillers can be particularly useful, because all you're doing is putting air back in the balloon. And as you put air back in the balloon, the face fills up in a more natural fashion. You lose a lot of those fine lines and wrinkles and sort of put the skin back in a place that looks more natural and effective to the patient. If it's gone beyond that, where you really need to pick up and stretch a lot, this is where you're really talking about surgery. Like, you need to cut some of that extra skin away, perhaps put some more filler in or do some kind of implants or something to rearrange the face in a way that makes it look more youthful and more natural. And sometimes you do it with the patient's own sort of tissue. Sometimes you have to add extra and other tissue. But in the end, what you're really looking for is to try to reconstruct parts of the face to get to that more youthful appearance. Frequency really helpful, because it will, to a certain degree, light up those little cells that make and repair your collagen. And so that is kind of the foundation of your skin and can do pretty good things that way too. Sometimes a combination of all these things, because you're bringing in the benefits of each one of these things together to kind of put this whole package together in a way that looks the best. So I think getting ahead of the curve, dealing with this kind of stuff by eating healthy, taking care of yourself, not smoking, being careful about the sun, all these kinds of things will, to a degree, slow down that process. Some people are born with great genes and hardly have to worry. Other people, unfortunately, not so good genes, might have things go wrong at an earlier stage. But no matter who you are, no matter what your genes are, if you see a problem coming early enough and you deal with it, you're less likely to need to spend a lot of money and a lot of time later to fix it. I look at it like keeping paint on the house versus waiting for the house to fall apart and then having to like put the whole house back together again. So a little bit of that keeping paint on the house can go a long ways towards keeping your face looking healthy and the rest of you looking healthy. And some of those are common, simple things like not ruining yourself with smoking and things that would otherwise kind of tear the house down faster. Don't excessively drink alcohol, eat healthy, pretty basic things. Getting a little exercise, really helpful.
What would you do for pregnancy melasma? Another question would be if someone has a droopy lid, but only on one side, what would you consider for that? Do you do surgery just on one side, or do you have to do surgery on both eyes?
Taking the first question about melasma, this is a relatively common problem, and it is a fairly complex one, but it boils down to a fairly simple thing. And that is that in your skin, you have these things called melanocytes, which are tiny cells that make the stuff called melanin, which is the pigment that gives your skin color. And they're under the influence of a variety of different things, genes being one. So some people will get very dark even if they're not exposed to light. Other people will hardly ever get dark even if they're exposed to light. But the unique thing about a melanocyte is that it is sensitive to light, and if you give it enough light, it will commonly make more melanin to protect the skin. So this is why a sun tan was probably a natural outgrowth of the fact that our fairly sensitive skin could become very easily injured if you didn't have a tan that would otherwise stop the light from getting in deeply and hurting your skin in ways that could cause skin cancer or other bigger problems that would make it hard to continue to survive. So looking at it from that survival model, we know that sun will influence these things. We know that hormones will influence these things. We know that genetics will influence these things. And some things we have control over and other things we don't. So anybody who has a tendency towards melasma, which is the so-called mask of pregnancy, where you get this darkening over parts of the face that are related to the hormonal balance that happens during pregnancy and how it affects those little cells to make more melanin, is to first realize that they are still going to be more stimulated by sunlight. So if that pregnant person can be even more cautious about being exposed to sun during their pregnancy and sometime after their pregnancy until their hormones kind of settle back down, then job number one is to be cautious about the sun, because that is going to add gas to the fire of these little cells making more of their melanin. When it comes to cells making too much melanin, you do have options that include turning the cells over faster so that the pigment that comes up through the epithelial cells is going to be shed quicker. And that would actually be things like retinols, retinoids, things that help to encourage skin turnover. There's also a thing called hydroquinone, which is a product that gets in the way of the pathway of making the melanin. So the cells are still there, they're still doing their thing, but they will do it less when they're told to do it less, which is what that particular product will do. You wouldn't necessarily want to use that during your pregnancy, but following the pregnancy, if you are now not concerned about having a baby in your womb, then applying that topical product would be isolated mostly to your skin, is going to influence those cells that you apply them to and will tell them to make less melanin. You would not want to use things like IPL because that's just going to irritate the cells, but there are ways to pick away at some of the pigment, and there are these picosecond lasers that can be used to gently pick away at the pigment. Some of these are also used for a laser tattoo removal or things along that nature. There are not good ways outside of some type of medical treatment, but there are a couple of other things that can be useful. One is a thing called kojic acid. These are things that appear to also get in the way a little bit of some of that melanin production. And then turning skin over faster with little acid peels. So there are these glycolate peels or fruit acid peels that can be applied to the skin that will also help in some of that turnover. You don't want